So when I first found myself becoming part of many infertility groups, and just kind of joining the infertility world as a whole, I was a bit overwhelmed by the insane amount of acronyms, sayings, and other random bullshit that are the norms on most of these sites. Now, this is by no means a complete list. There's a longer list available on my Tumblr for anyone that is interested. So, for anyone new to or anyone that reads my post and is wondering what the fuck does that mean, this video is for you.
Well, let's start with the basics. These are some of the most commonly used acronyms. Trying to conceive. That time in a couple's relationship when they stop fucking for fun and actually try to make a baby. Infertility. The ironic realization that after years of trying not to get knocked up, you find out you can't get knocked up. Secondary infertility. So, you had no problem getting pregnant the first time. It was easy after a night drinking in Cabo doing body shots off strangers and lines of Molly off your boyfriend's dick. Now, it's 3 years later and you two finally have your shit together and you and your now spouse want baby number 2. Only to find that for some reason you can't. Bam, secondary infertility. Male factor. When infertility is due to an issue with the male, usually poor sperm count, morphology, or mobility. Cervical mucus. Some use consistency to determine fertility levels, etc. And don't worry, if you are part of an infertility group, this is something you will see far too many photos of. Baby dust. Sugary, sweet, rainbow and puppy dog way of saying good luck. Up next, what time of month is it anyway? Cycle number, the number of failed attempts plus 1. Ant flow. Menstruation. This is the day that resets your cycle and occasionally results in a crying fit. Cycle day begins on the first day of your period. Ovulation. Days post-ovulation. Days into your 2-week wait. 2-week wait. The 2 weeks post-ovulation that cause craziness. A person to use an insane number of pregnancy tests and obsessively Google early pregnancy symptoms and forces a person to obsess over every cramp, temperature change, sore boob, and mundane symptom as a possible pregnancy sign. Baby dance, baby making sex. These are super annoying terms used to describe sex because being adult enough to have a child but being uncomfortable using the term sex makes complete sense. Sure, timed intercourse may seem fun, but forcing your husband to have sex with you based on a positive ovulation strip is often the least romantic sex you will have outside of paying for it. The players. Dear, darling, devoted husband, this is an acronym I never truly understood. I should hope that if you married this individual, you at least find them dear, darling, or at the very least devoted, and they're not just some random asshole that wants nothing to do with you. Reproductive endocrinologist. This is part of your new baby-making team. These doctors specialize in reproductive hormones, and you will become very acquainted with them. Hormones will make up a huge portion of your life now, and so here are a few hormones. Never really been sure how to pronounce this, but the surge of this hormone indicates ovulation. This is simply the pregnancy hormone. A surge in this hormone indicates positive pregnancy test. Follicle stimulating hormone. Birth control pills. These pills will be taken prior to IVF as a means of controlling your cycle. Ironically, they've also been used for years to prevent having a baby. There are many tests that will be referenced frequently. The test. Semen analysis used to measure the quantity and quality and mobility of sperm. LH strips are used to detect an increase in hormone that indicates ovulation. Basal body temperature. This uses a BBT thermometer to identify and chart slight changes in temperature. This is done each morning at the same time prior to getting out of bed. An increase in temperature indicates possible ovulation, and later possible pregnancy. Some women will chart these temperatures. These women are saints. I am no saint. That shit drove me crazy. I use LH strips. Home pregnancy test or early pregnancy test. You will go through a shit ton of these, so buy in bulk. Ovulation predictor kits or ovulation predictor tests. These are used to detect an LH surge and to better predict ovulation days or high fertility days. Also purchase these in bulk. Big Fat Negative is a negative pregnancy test and the reason you buy in bulk. Big Fat Positive is the holy grail and reasons that will make you both ecstatic and terrified that it will end in a miscarriage. Then there are the procedures, none of which I can pronounce. For example, this one is an acronym you will see all the time. It is essentially an X-ray that looks at the inside of the uterus and fallopian tubes to identify blockages. The procedure consists of inserting a catheter into the cervix and injecting dye while under an X-ray machine. This process isolates a single sperm and injects it directly into an egg. This process is usually used when there is an issue with sperm. An IUI is the process of using a catheter to inject washed sperm directly into the uterus. The saline injection sonogram is used to identify issues within the uterus. Similar to the HSG testing, however, this uses a transvaginal ultrasound to determine any abnormalities within the uterus. Frozen embryo transfer. This uses embryos previously frozen to conduct an embryo transfer, a process by which embryos are placed into the uterus of a female with the intent to establish a pregnancy. Sperm washing is a process that separates the sperm from the rest of the fluid that makes up semen. The final product looks something like this, and it is used during the IUI process. A few problems. Common infertility problems. Endometriosis, an often painful disease that causes scar tissue to build up on the outside of the uterus. This can cause infertility. Polycystic ovarian syndrome. Caused by a hormonal imbalance, this can cause ovarian cysts and irregular periods, as well as differences in hormone levels. Ovarian hyperstimulation syndrome. Usually this occurs when on injectables or some other aggressive form of fertility treatments. Ovaries become swollen and painful due to the production of several follicles.